Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Mini International Neuropsychiatric Interview assesses a wide range of psychiatric disorders according to standardized diagnostic criteria. Its main purpose is to facilitate the rapid and accurate identification of major mental health conditions, including mood disorders, anxiety disorders, psychotic disorders, substance use disorders, and post-traumatic stress disorder. The instrument is designed for use in clinical and research settings to improve diagnostic reliability and ensure consistent evaluation across different healthcare providers. It evaluates symptoms related to depression, bipolar disorder, schizophrenia, panic disorder, and other common psychiatric illnesses. The tool enhances diagnostic precision by systematically covering essential diagnostic domains within a structured interview format. The Mini International Neuropsychiatric Interview is indicated for adult patients and adolescents suspected of having psychiatric disorders, including mood, anxiety, psychotic, and substance use disorders. It is validated for use in both outpatient and inpatient clinical settings. The tool is particularly useful in psychiatric, primary care, and general hospital environments where rapid and standardized diagnostic assessment is required. Its structured format facilitates diagnosis in populations with varied cultural and clinical backgrounds, supporting clinical decision-making and research inclusion criteria. The Mini International Neuropsychiatric Interview consists of 109 structured diagnostic items. It covers major psychiatric disorders through closed-ended, primarily yes or no questions. The interviewer administers the instrument verbally, following a predetermined flowchart to ensure systematic assessment. Each diagnostic module begins with screening questions. If responses indicate potential pathology, more detailed symptom questions follow. The format facilitates rapid administration, typically requiring between 15 and 30 minutes. Responses are scored by tallying affirmative answers relevant to each disorder module. Interpretation compares the total symptom counts per module to established diagnostic criteria. A positive diagnosis is made when the symptom threshold for a specific disorder is met or exceeded according to the Diagnostic and Statistical Manual of Mental Disorders Standards. The instrument does not provide numerical severity scores, but rather categorical diagnoses indicating the presence or absence of specific psychiatric conditions. The Mini's structured approach limits subjective bias and enhances diagnostic reliability across diverse settings. The Mini International Neuropsychiatric Interview demonstrates high sensitivity and specificity in diagnosing psychiatric disorders. Sensitivity refers to the instrument's ability to correctly identify patients who have a particular disorder, while specificity indicates its ability to correctly exclude those without the disorder. Studies report that the Mini International Neuropsychiatric Interview has sensitivity values ranging from 0.8 to 0.95, meaning it accurately detects 80 to 95% of true cases. Specificity values are generally between 0.8 and 0.9, reflecting a true negative rate of 80 to 90%. For example, in diagnosing major depressive disorder, a sensitivity of 0.9 implies that 90% of patients with depression are correctly identified by the Mini International Neuropsychiatric Interview, reducing false negatives. Likewise, a specificity of 0.85 indicates that 85% of non-depressed patients are correctly excluded, minimizing false positives. These metrics underscore the clinical utility of the Mini International Neuropsychiatric Interview in reliably screening and diagnosing psychiatric conditions. The Mini International Neuropsychiatric Interview was developed in the early 1990s by a group of psychiatrists and researchers led by Felipe Sheehan and colleagues to provide a brief, structured diagnostic interview for major psychiatric disorders aligned with the Diagnostic and Statistical Manual of Mental Disorders and the International Classification of Diseases criteria. Validation studies conducted during its initial development demonstrated strong reliability and validity when compared to more extensive diagnostic interviews, such as the Structured Clinical Interview for DSM disorders and the Composite International Diagnostic Interview. Subsequent research has reported sensitivity and specificity values frequently exceeding 0.85 for key psychiatric diagnoses, including major depressive disorder, generalized anxiety disorder, and substance use disorders. The instrument has been translated and validated across multiple languages and cultural settings, consistently showing robust psychometric properties, which supports its utility in diverse clinical and research environments. Meta-analyses and systematic reviews published since the 2000s have further substantiated these findings by confirming the Mini International Neuropsychiatric Interview's accuracy, efficiency, and capacity to facilitate reliable psychiatric diagnosis within a relatively short administration time. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.